7 o'clock in Barbados and across the Eastern Caribbean. It's time for the Pulse Radio Show, a production of the Queen Elizabeth Hospital. I'm your host, Shane Seeley. Always a pleasure to be with you at this time on a Monday morning. Of course, you know we talk about everything QEH, all that is happening there, and a lot has been happening at our hospital. A number of projects unfolding which speak to some environmental enhancements. I want to speak first of all to ophthalmology and salute our ophthalmology team. They were moved for the majority of last week to B2, and now they are going back to their original location, which is, as we all know, in the Lions Eye Care Clinic on the second floor. Now, that will happen between tomorrow and Wednesday. Of course, with any move, you have to move equipment and then you have to take it back to its place of origin. So what will happen tomorrow? Our teams from the ophthalmology department will be calling those who have appointments and letting you know when to come, whether it be tomorrow or another day in the week. What will also happen, there will be a staggered setup going into tomorrow morning. Of course, those who need to be at clinic will know in advance, and we will also give you that option of calling ahead if you're a bit unsure. You can always call the Patient Advice and Liaison Service at 536-4800. Our medical team there will be able to do the legwork for you and find out if indeed you are to come to clinic tomorrow or when your clinic appointment would be. And then there's a direct number for the ophthalmology clinic, which I will give you a bit later on in the show. Also, we continue another project there, our shutter project. We are getting ready already. Yes, it's February, but that will not stop us. And our engineering department salute to the team there for preparing for the hurricane season. We're being assisted by some donors, the Carolina Foundation, and that project is moving ahead nicely. We already have some of the facilities shuttered up in the event that we are affected by adverse weather. And you know, we have had some high winds recently, so they have been really kicking up. But we've made sure that we are building resilience at our hospital, and we will continue to do that as we also prepare early on for the Atlantic hurricane season, and we are doing other things in that regard. Just a reminder to you, we are being brought to you today by our kind sponsors for a third season, episode 2 in that third season, by MedSafe Medical Supplies. You know, you can find them on Gemmett's Lane, easy location to find, and all that you need as far as medical supplies are concerned. We really thank them for signing on for yet another season. They are our partners, and they have been making sure that you can hear us every Monday at this time, 11 a.m. to 12 p.m. on Q100.7 FM. Before I give you those numbers to call, I have to introduce returning to the show for a second week in the row because we had so much things to discuss last week. It's spilling over into this week. We had a number of calls, and we want those calls to keep on coming. A number of complaints that we were able to respond to, investigate, and get those best results for those patients who would have called and left their number with our producer. Producer today is Kimberly Skeet. But let me say good morning again to our head of accident and emergency at the Queen Elizabeth Hospital, Dr. Anne-Marie Cruickshank, consultant, and Dr. Anne-Marie Cruickshank. Dr. Cruickshank, always great to speak to you and have you here with us on the Pulse Radio Show.
Good morning, Shane, and thank you again for inviting me.
Of course, I have to, because we were speaking about it last week, how busy we were in the latter part of January going into early February, dealing with that surge in patients. We've been able to contain that somewhat, but we want to always give people that best direction, that best opportunity to get the best result as far as their health is concerned. It's all about getting those positive outcomes. That's what we aim for. We don't want people waiting long in the accident and emergency department. We don't want people having negative outcomes. But we want Barbadians generally to be more responsible, put their health first. So that's why this season of the Pulse Radio Show, we're putting you in that mindset. helping you to make your health a priority and best directing you where you can go to get your health managed, whether it be the accident and emergency department or any other medical facility, polyclinic, private medical physician, etc. So Dr. Cruickshank, last week we were focusing on all of the enhancements coming for accident and emergency. You want to start there again?
Yeah, let's let's go back and talk about the CAT scan.
Yes.
I had mentioned it last time, and I want to mention it again because, as I said, this is the first time the A&E is having a CAT scan. We have one in the main radiology department, but we never had one in the A&E. So we're feeling very proud for this donation to the A&E. And the CAT scan should be ready between this week and next week. They are moving fast. The radiographers are being trained on the machine, and we have actually started as a test using some of the patients in the A&E who are waiting for CAT scans upstairs. We're actually doing some of them downstairs in the new CAT scan suite.
Wonderful.
So
Wonderful.
we're feeling quite proud and happy about that.
Right, and that CAT scan operation, once it's fully operational and really serving Barbadians in the way that it should, that will be running 24 hours. That's the idea?
Yes, we have been reassured by the director of the radiology department that it will be running 24 hours,
Yes.
7 days a week.
And that will be the Director of Clinical and Diagnostic Services, Dr. the Most Honorable Corey Ford.
Yes.
Yes, I know that he insisted that this operation be 24 hours because things can happen at any time.
Correct.
Patients come into the hospital at any time, 24 hours, as far as the accident and emergency department is concerned.
Yes. We are a 24-hour operation every day of the week. So we're very pleased to be having that facility starting. The next thing I want to talk about is the X-ray suite. We had X-rays before in the A&E. We've always had X-rays. But when we were having the renovations, that was put on pause. And we had to go to the main radiology department for our X-rays.
Okay.
We are happy to announce that that suite will soon be opened within a few weeks so that we would have both CAT scan and X-rays for the patients in the A&E.
What would this mean in terms of response and making sure that you can deliver service in a timely manner? We don't hide from it. Since we've been coming on the Pulse Radio Show, we've heard those complaints for whatever reason about long waits. How will that help to address that?
Well, you know, when we had to go to the main radiology department, we had to the patient had to be accompanied most times by an orderly or a nurse to transport them to the main radiology department. That takes time. So now when we have the X-ray and the CAT scan in the A&E, it's just a matter of going a few feet. Once the radiographer is ready for the patient and the patient is ready to go, it is just a few feet to the radiology and the CAT scan suite. So hopefully that would reduce the transportation time to have these imaging and therefore reduce the overall time for the management of the patient in the A&E.
Okay, a reminder of those numbers that you can call to make your concerns heard or share a compliment right here on the Pulse Radio Show. You can call 434-1007, 434-1070. You can also send us a WhatsApp at 434-1007. We have a caller on the line. Good morning. Welcome to the Pulse Radio Show. How can we help?
Peace be on to each and everyone. Blessed good morning.
I love when callers start with that because it puts us in the frame of mind that we can be peaceful and that we can focus on really helping any caller who comes thereafter. So you appreciate that.
Well, Shane, I am not perfect, but I know the God that I am serving, and it is through that hospital and some good doctors. I guess one of them may be vexed because I always mention his name. That have me alive today. I ain't calling the name again.
You're calling the name again?
No, because some people don't like publicity, and I feel he probably don't want me to mention his name, but it is he who have me alive today. He and the specialist and the other doctors. So I have to thank him every day, and every day I pray for him.
A team of doctors
who have
working
me here
together.
Today.
Yes,
but Shane, I want to say thanks to every cause. If I had anytime I had to win money, I would donate just the godly Reverend said today how if he had to win the lotto, he would contribute to it. Just if I had to win money, I donate things to the hospital.
And our philanthropy officer will be very happy.
I have to be there, even although I don't have, and there's anything that I could contribute. If there's anything that you all need, I could contribute. I still would. So I want to thank those persons who donate the CAT scan. We really needed one.
Yeah.
And I'm glad that we're going to get an MRI machine.
Yeah.
And Dr. Ford, I love Dr. Ford. I just hope that he will keep to his promise. And I am praying for betterment at the hospital. I am praying for the best, especially in accident and emergency.
Yeah.
And as I would always say, I hope you and the church and the board sit down and decide to allow persons who have the family there the afternoon and the evening. For me, there's just allow who want to come, who would volunteer and come and look after their family. Let us come in and help look after our family. That's what I would love to see before I close my eyes.
Well, funny enough, you mentioned something that the hospital is actively look at. It has happened in the past, and we are really looking to reactivate it in a big way, and that is our volunteer program.
Right, yeah.
And there is a policy associated with that. It is being examined, and in short order, we will know how we can really reinvigorate a program which encourages volunteerism in a big way, so that those who really want to come in and not only sharing the experience but help those patients in whatever way they can, assisted by our medical staff and directed by our medical staff, that they can share that spirit of volunteerism right across the hospital.
A friend called me over this weekend and was asking me about the eye clinic. So when I heard you spoke just now on that, I said, well, glad I hope he's listening, because he have to go. He have an appointment too, and he was asking me where it was, but I don't know where it is now.
I remember sending out that notice. So it was in B2. They're making the transition back to the ophthalmology clinic. So what really happened is we were making sure that the clinic, the original clinic, was environmentally enhanced.
Yes,
a thorough cleaning, AC ducts, everything to make sure that when patients come in, they can be assured that they're in a comfortable and safe space. Safe is the most important. Safe, and as you mentioned, clean space.
Yes.
Our housekeeping team is now working at another part of the deep clean, so that by tomorrow we will start those staggered appointments, and then by Wednesday we should be back in full operation in the Lions Eye Care Center on the second floor for the ophthalmology clinic. Yes,
but back to what you first started with about, what I said about we got every day these days I notice a lot of persons just collapsing, and you're seeing them this morning and this afternoon. You hear they're gone. People just collapsing, and then so every day you have to give God thanks for the day and all who you could assist and help. You have to do that now. We must be our brother's keepers and know everybody won't get along, and that is life. It is life in the Bible. You can see it. So I think only me that imperfect.
Yeah.
But every day we have to give him thanks. So I know my life, and I have been around persons, my family and friends who've been sick and passed and gone, and I know that I have to cherish my life, and always remember those who are less fortunate and those who are sick.
You're hitting some key points that we will be discussing today as well. That you mentioned persons collapsing. It is something that we will look at this morning. You also mentioned something else there that is very, very critical that we are looking at to see how we can better address the needs of patients. So you listen, continue to listen to the program.
Thank you very much, and I'm glad for this program. And when you go and give my love to Dr. Ford, and
I'll tell you this: you'll get your personal opportunity week after. He will be
Okay,
here.
he'll be there.
Yeah, he'll be here week after
Right.
to talk about a lot of these enhancements coming, especially in his directorate.
Well,
So you stay tuned.
At first, when this thing first started, I said I hope it don't be late service. But I'm seeing some progress, and I hope and pray that God will continue. And I just want to say before I leave, thank all those persons who contributed, companies, help me pronounce the word because I'm a bit tight on right. And
you doing well.
You know, groups, especially our family that overseas that
in the diaspora,
donating, yes, and sending home to assist the hospital, because they say a healthy country is a progressive and good production in the country. If we are not healthy, the economy can grow nor strive.
Indeed.
Thank you very much.
And thank you for calling and sharing right here on the Pulse Radio Show. Dr. Cruickshank, you heard the caller there speaking about people just simply dropping down. It's a lot more than that, and you've been seeing a number of categories of people during that surge period coming into hospital for a number of reasons. A lot of them associated with the scourge that is affecting Barbados right now. We hear how the Ministry of Health and Wellness is trying to put policies and action in place to manage this crisis in Barbados with chronic non-communicable diseases. And we'll speak about it after this commercial break.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're listening to the Pulse Radio Show. Those numbers to call: 4341007, 4341070, and you can also send us a WhatsApp at 4341007. We want to hear from you as we try to get your feedback on how we can better improve our hospital to serve you. Of course, we had a number of inputs from you as we unveil the 25 to 28, that's the 2025 to 2028 strategy led by our Chief Executive Officer Neil Clark. That strategy is being put into action, and you'll see a lot of that action executed throughout this year, and you'll hear more about it right here on the Pulse Radio Show. I'm here with Dr. Anne-Marie Cruickshank, and we must really thank, and you heard the caller mention those in the diaspora and those donors to the hospital. That CT scanner, someone donated that, an organization, I should say, spiritual organization, donated that to the Queen Elizabeth Hospital. So we really got to thank those who have been, delivering and helping us in that enhancement of care, that movement that we are having at our hospital.
Yes, Shane. The caller before talked about if she had won money, she would donate it to the hospital, and she touched on a very important point, because philanthropy plays a major part in the hospital, and especially in the A&E. We have been blessed with a lot of philanthropic donations, and as you rightly said, the CAT scan was donated by the Jesus Christ of Latter-day Saints. So we are very blessed that they took that initiative to give us that CAT scan machine. Other donors we had, for example, like the Great Pacific Trust, is an insurance company that is one of the friends of the A&E that has donated thousands of dollars in terms of equipment and other important supplies for the A&E.
Wow.
We have Sol Barbados, who has also donated thousands of dollars. And then we have relatives of patients who have been satisfied with the care that they received and have donated money in order for us to buy, for example, wheelchairs and recliner chairs and other important equipment. So philanthropy is a very important part of the initiatives in the A&E for 2025.
Before we get into the scourge of NCDs and how the A&E has been responding to the call as far as that crisis is concerned, speak about those recliner chairs, because recently you have got you received a welcome donation of recliner chairs, and that is an important feature for the accident and emergency department going forward, and hopefully we can see more donors go in that direction with the recliner chairs as well.
So we recently got funds to buy equipment, and I decided that I was going to go with recliner chairs because we have so many patients who we can't offer a bed to, and they have to sit on a chair. And as you well know, Jane, after sitting on a chair for many hours, it's very uncomfortable. So my aim eventually is to get rid of those chairs and have recliner chairs for patients who we may not be able to offer a bed to, but we can give them a recliner chair so that they can at least be comfortable while they wait for the different results and specialties to see them. And that's my aim. So we recently got 3 recliner chairs, making a total of 4. And I'm hoping another donor, I've just finished talking this morning, to give us another set of recliner chairs.
Gay
so we're
Howell.
looking forward to that.
Gay Howell is a name that you need to get familiar with. She is our lead on philanthropy. You can contact the Patient Advice and Liaison Service 536-4800, and then through them you can reach out to Gay, and she will help to direct these donations to our hospital so we can do that good for Annie and get some more recliner chairs. We have a start. We have to keep going, and we thank all of those donors here in Barbados, in the diaspora, and across the world for that major support that we've been getting at our hospital. But let's get into how AED has been managing those people living with cardiovascular challenges, cardiovascular disease, diabetes, hypertension. These are some of the chronic diseases that have been really taking a toll on our population. The Accident and Emergency Department has been the recipient of a high number of them end of January going into February, and I really wanted to delve into them category by category. Let's start with the most major one, Dr. Cruickshank.
So Shane, we see a lot of hypertensive emergencies, persons who are not taking their medications, and they're presenting now with elevated blood pressures, and then the complications of those elevated blood pressures. And that can be anything from a heart attack, or it affects your brain, as we said, heart attack, your kidneys, etc. You come in with altered mental status because the blood pressure is so high, you're confused. Right? Also the diabetic emergencies, we're seeing those too, and once again those are causing the complications of the heart attacks and the end-stage renal disease. So those are the major categories, and then we see the complications with the renal emergencies, the heart attacks, and the strokes. So those, I would say, are the top 5 that we see on a regular basis in the A&E, and the complications being, for example, heart failure.
Why are there complications in the first place? What is the result of some of these complications? Where do they originate? What is your assessment there?
We have to go back to primary care. Persons not taking their medications or not repeating their prescriptions. They're not following the diet plan as set out by their primary care physician. They're not following the treatment plan as outlined by their specialist or primary care physician, and then again not getting the regular exercise which is necessary for a lot of these chronic diseases to manage them appropriately. So we're not complying with our primary care treatment, and therefore you're coming now to tertiary care with all the complications.
And I know you can only get this information on assessment and of course having that conversation with some of these patients.
Yes.
So they're basically saying over probably Christmas or early January fun time, I haven't been taking my meds as I should. So they're really admitting to some of the mistakes that they would have made in not prioritizing their health care.
Exactly, or missing their dialysis appointments.
Oh dear.
Right, not eating the right diet. So we know increased cholesterol and increased weight can predispose to a lot of these NCDs. So basically not complying with our primary care ends up with the complications in tertiary care, and then we in the AE now have to manage these patients in addition to the other trauma and that we see coming through the door. So our hands are quite full and busy in the AE.
No, so that has happened, and being proactive, we want people to be proactive, but we on our side have to be proactive as well. So there are some partnerships that we are forming to try and ensure, especially on the cardiovascular side of things and in terms of the cardiovascular response, that we can get ahead of the curve to help some of those who come in with challenges in that regard. Talk a bit about what we are really trying to enact in terms of working with other healthcare providers in terms of dealing with those issues with cardiac disease and cardiac care.
Well, in an attempt to be proactive, especially, for example, with the heart attacks, the QEH has co-partnered with Brighton Stokes to do something called the Metalize Project, where we are partnering with Brighton Stokes, and we are now giving a particular drug called Metalize. That drug is a clot buster that is used in the management of heart attacks if we can get the heart attack diagnosed quickly within a particular timeline. So we are giving this drug to several urgent care facilities. And for example, with these patients with heart attacks present to the urgent care facilities, they then can speak to the cardiologist on call in the A&E, or I should say in the hospital, and the cardiologist will get the full history, the examination, the investigations, and if they think, yes, this person has a heart attack, we can start delivering the Metalize or the clot buster at the urgent care before they come to the A&E.
Oh.
That saves a lot of time, and once the patient is stable, they then can be transferred to the A&E. That is soon to be starting. We're hoping in March, but if not, if we don't have the drug, as soon as possible. But that is an initiative of the cardiology department, QVH, and Brighton Stokes with the urgent care facilities in Barbados.
So partnerships, again, key to making sure that we can respond to some of the needs of the community. So that is what we are doing as far as those with cardiovascular challenges are concerned. Remember, you can call us 434-1007, 434-1070, or you can send us a WhatsApp at 434-1007. So I know that you can't stop dealing with the cardiology situation in Barbados. We have a caller on the line and we are coming to you, but then we are going to go to a bit of what we're doing as far as monitoring those living with diabetes, that high blood sugar. Let's go to the phone lines very quickly. We have two callers on the line. Good morning, caller. Welcome to the Pulse Radio Show. I'm here with the head of Accident and Emergency, Dr. Anne-Marie Cruickshank. How can we help?
Good morning to you, sir.
Good morning. How are you doing?
Is there any coordination between the polyclinic and the Queen Elizabeth Hospital as far as medication is concerned?
Medication. I'll let Dr. Cruickshank answer that. Is there coordination as far as medication is concerned?
Right. So a prescription written at the Queen Elizabeth Hospital can be filled at the polyclinic. So you don't necessarily have to go in line in the pharmacy. You can go across to the polyclinic and get your prescription filled. Having said that, however, a prescription from the polyclinic cannot be filled at the Queen Elizabeth Hospital. It only goes in one direction.
Yeah.
And similarly, we have the home delivery system at the Queen Elizabeth Hospital.
Right, I understand that.
Yes.
But what I'm asking is, if you are attending the Queen Elizabeth Hospital on a matter, and you're also attending the polyclinic on a matter, in my case, I find sometimes medication is duplicated. And so when it's duplicated from both the QEH and the polyclinic, and you decide, well, let me get rid of all this medication before I go back for more, you tell me your period is out.
It's important, caller, that you tell your specialist doctor what medications you are on from the polyclinic so that you don't get duplication. Until we get the HIS system, when all the clinics
health
will
information
be, yes,
system, yes.
and they'll all be speaking and we can see what is happening at the polyclinic and at the QEH, you're going to have to
that is done.
Yeah.
That is done. In fact, the doctor looks at what I am getting from the QEH. But then when I do not see what I'm getting, I just have to go to this particular polyclinic I'm talking about. I just got to show my ID card.
Mm-hmm.
Mm-hmm. So I don't even know that I'm getting the same medication that I'm already getting from the QEH, even though the doctor is saying it. until I get home and I open it. So, but it's the same, some of this is the same medication I'm already getting.
So what you may want to do is when you're at the pharmacy, check with the pharmacist, confirm with them that you're not getting a duplication, and they can make the adjustments in the system to know that, well, I'm not going to give you another set of the same medication, because we don't want wastage, and we don't want you to overdose also on the same medication.
But that doesn't mean, because sometimes I get the same medication, but it's a different name medication.
Understood.
So now you got to go on Google to check to see what is this. And well, it's the same thing as this other one. Everybody does not have that.
I understand.
They're doing that, and they can be over medicating.
Yes, indeed.
So I think there needs to be some coordination between what I think I only talk about my case, where the doctor is seeing what I am getting at the QEH. But then I don't think that they should prescribe the same thing when it's coming from them.
Right. So that's why, that conversation, not only with the doctor, but the pharmacist as well. So we can ensure that there's no duplication in that regard. I remember Dr. Ford saying recently that he saw a patient bring back some medication, that they unused medication because they had enough previously.
Right.
So, it gives the opportunity for someone else to get that much needed medication as well. So it's good that you highlighted this for us, but make sure that you have that conversation with your doctor and then also with the pharmacist, so that this situation could be addressed and nipped in the bud early, so that you don't get home with more than you need or what you don't need as well. So I hope that answers your question.
90% of it.
90%. The other 10%.
90%. Yeah.
The other 10% can be answered by your patient advice and liaison service. If you call 536-4800 and you relay the same information that you did right here with us, they can help to direct you so that this doesn't repeat itself. This situation wouldn't continue to repeat itself, and that you are satisfied with the outcome. As you said, you're a patient of the Queen Elizabeth Hospital. You give them your identification, your hospital number, and they will be able to assist you in this regard. 536-4800. That would fulfill that other 10%, so that we can have 100% satisfaction rate, at least for you.
Thank you very much.
You're very welcome. Let's go to our next caller here on the Pulse Radio Show. Good morning, caller. Welcome to the radio show. How can we help? Pulse Radio Show.
Yeah, pleasant good morning to you, Shane.
Good morning. How are you doing?
I'm fine, thank you. And you are the person with you is Dr.
Cruickshank.
Dr. Cruickshank, good morning to you, ma'am.
Good morning, ma'am.
And how are you today, both of you?
I'm doing well, thank you.
I'm
you
here
good,
getting
Shane?
some coffee to sipping some coffee in between. That's okay that I sip. I don't do it too often. This is like
It wasn't this only coffee.
Yeah. It's French vanilla coffee.
I'm gonna Kimberly check. Kimberly check that for me.
Yeah, Kimberly. Yeah, she's a good inspector. She's
Yes,
a good
please.
investigator.
You don't want nothing else in it but coffee.
Not on a Monday, especially.
Oh, you might want a Richie Friday.
Take a little chance there. But how can we help though?
Anyhow, this morning I want to say thanks to your help desk. That is 536-4800.
Yes, patient advice and liaison service. That's the hospital pal.
I talked to a doctor there, I don't know if I right name, but Dr. Monsu?
No, Dr. Mwanza.
Monza.
Yes, Dr.
Yeah,
Mwanza.
Dr. Monza and Dr. Holloway.
Yeah, Dr. Hathaway.
Hathaway helped me last year, but Monza helped me this year.
Okay.
I had an issue with my son and some appointments and so on that was going backward all the time, putting off then like all the time. So I called for you first.
Right.
I asked to get you.
No problem.
And I told me before I get it to you, let them see if they can help me.
I appreciate that.
They did. And I was so surprised one morning when I picked up the phone and answered. The same doctor called me and said to me, Marcel, I haven't forgotten you. Just that I'm trying to get through to get the notes and so on, so I can better help you with what's going on and so on. Yeah. And then she said to me, I would get back to you. And she did it again, call back and tell me everything looking good and she's going to send forward whatever. And then the doctor that I really wanted called my son and talked to him and started up something for him that is more, that faster.
That's lovely.
So I want to say thanks very much to the help desk. It's not only carrying the name, but it's doing its job.
I'm very glad to hear that, and I'm glad that we could assist your son, make sure that he's medically covered, and I hope that he's doing a lot better now.
Really, he's coming along because he's under the Dr. Dwayne Hood over at Physio.
Right.
So he's coming along.
Yeah,
I do want to salute that section also, the physio section. Some persons will tell me it's calling and talk about the hospital and the things that, some things that are not right, but I tell them I can't talk about the things that I haven't experienced.
Mm-hmm.
And when I can't talk of my experience.
Well, I'll say this, as our earlier caller said, we are not perfect.
No.
We have a CEO that is working with the executive team, the chief operations officer, Dr. Greenidge, and the rest of the directors and the entire team to try to make some improvements across the hospital. Things can't happen overnight. Change of this magnitude, which would have been unveiled in the 2025 to 2028 strategy, will not happen overnight. It will be systematic, and it will come step by step, brick by brick, but it will come. So you'll see change by change. You heard Dr. Cruickshank mention the CT scanner. That's one of the things that we spoke about last year. And once that gets 24 hours, we really hope that we see that transition in terms of bringing down those wait times. But at the same time, we're encouraging people that if your situation is not that urgent, and I was thinking about a scenario this morning while I was in the bath, and I'll share it with Dr. Cruickshank to see if she can better help me and direct me. You know, if your situation is not that urgent, if you have like a cold, you know, you may be feeling a bit stuffy, the accident and emergency is not the place for you.
No.
You come, it's called accident and emergency. So, you know, I really want people to focus in as we try to help people make their health care a priority this year. Pay more attention to your actions and to what you do when you are seeking health care. Know where you need to go, know where your options are in terms of the point of care, but know when you need to come to accident and emergency. And as you mentioned, the help desk can definitely direct you. So I always advise people, you know, call 536-4800 and share your symptoms, share what you're feeling, and they will tell you, you know, right now you need an ambulance. And they can give you some direction in that regard too.
Yes. And I must say a good morning at this time to the staff of Ward C5, Ward B6, and Ward B8. I went there recently, and that was well received, and the nurses were very kind. So I want to say good morning to them.
Work in progress as well, and we thank you for the kudos and sharing it with us right here on the Pulse Radio Show, Marcel.
You are more than welcome. Have a beautiful day. Sip your coffee, and Cruickshank, make sure you give you a little of it, please.
And I will continue to sip it. Thanks, Marcel. I will continue to sip it during this commercial break as we take a pause right here on the Pulse Radio Show. Of course, this show is being brought to you compliments MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Welcome back to the Pulse Radio Show. You have 20 minutes more to spend with us right here on Q100.7 FM as we talk about your health and making it a priority in 2025. I'm Shane Seeley. Alongside me is Dr. Anne-Marie Cruickshank, the head of the Accident and Emergency Department, who has been very happy recently, despite the workload coming through the doors of the Accident and Emergency Department. We've been better able to respond to the needs in most cases. I'm not saying we always get it right. That would be untrue. We try to get it right all the time. It doesn't go that way all the time because we're not perfect. but we're trying to improve the way we conduct business and help our patients coming through the doors of accident and emergency in as timely a manner as is humanly possible. And we're going to get some help in that regard, right, Dr. Cruickshank?
Yes. So remember, Shane, last year we talked about the different triage categories in the A&E, that when you come into the A&E, you are met, first of all, by security, then the medical records officer who registers you, but then the third important person is the triage nurse or the screening nurse. And she gives you a category depending on the presenting complaint, depending on what your complaint is. And we know that in the A&E, we have 5 categories, 1, 2, 3, 4, and 5. And obviously 1, 2, and 3 are the severe ones that really should be in the A&E.
Right.
But the other category, category 4, are what we call walking wounded, in that they can wait quite comfortably if their condition is not that serious. Mm-hmm. So we do have other facilities that can assist us with these category 4 patients. And the one that is very close to us is the 24-hour clinic, which is located at Sir Winston Scott Polyclinic.
Gemmett's Lane.
Yes, Gemmett's Lane. And they're open 24 hours, similarly to the A&E. So if the nurse triages you as a category 4, and it's something that doesn't need to be seen in the A&E, she would refer you to the 24-hour urgent care clinic at Sir Winston Scott Polyclinic. And in the night, if there's no transportation, we can get the QEH taxi to assist us to transport you across if you have no transportation of your own. So that is the first line that we would advise when we refer you. But we have other care facilities like the polyclinics. Mm-hmm. They, as we mentioned, can do primary health care. So you may not have to come to the A&E if your blood sugar is high and you don't have a complication of that high blood sugar, or your blood pressure is high and there's no complication in that you just didn't take your medication or you didn't get your prescription filled. We can refer you to your primary care facility, which is your polyclinic doctor or your private care doctor.
Indeed.
In addition to those, we now have in Barbados the urgent care facilities, and there's several of those in Barbados who work in conjunction with us, who stabilize patients and treat. And they don't necessarily have to refer, they can treat and discharge. So there are other facilities that can assist patients in addition to coming to the A&E.
Wonderful. And it's all about having those options available to you. Many people before would have seen the accident and emergency department as the first point when you think about healthcare. I'm sick, let me go to accident and emergency. This is 2025. We're trying to move in a different direction because accident and emergency has a specific target audience, which would be the most serious patients. For other situations, other medical concerns, and again, we continue to share that number with you, 536-4800, if you are unsure. You know, you may be home and you may not be clear as to how you're feeling, but you know you're not feeling well. And you know you're feeling worse than usual. You can call that number and get some assistance and guidance. But if you're that unsure and you know that this isn't going in the direction you think it should, you come to the accident and emergency. The team there would, as you say, you come through security, you come through the medical records clerk and be registered, then you come through that triage nurse who would assess your situation to determine the level of seriousness of your situation. Correct, Dr. Cruickshank?
That is very correct, Shane. And we have trained triage nurses who are experienced nurses who have worked in the A&E for many years. There are some who have now come, but they've done the triage course or they're soon to do the triage course. So they know what is before them and how to triage them. And we have the doctors and senior nurses on duty too who they can get advice from. So we're saying that if you come and we think that your case is something that can be managed in another facility, we will refer you there. Also, to Shane, these urgent care facilities are sometimes as outfitted as best as we do. They have CAT scans, they have ultrasounds, they have x-rays too. We know it's a cost, but if you do have that finance, you can go there. And if they think that you need to be referred to the A&E, they will call us and refer with results, reports, etc., which helps us quickly in the management of the patient to get them to these specialties.
It helps to speed up things, and I've heard a few cases just over the weekend where such was done so that it can help our doctors to make a quicker judgment.
Correct.
And decide what course of treatment needs to be administered next for that patient. So all of these, would you say, Dr. Cruickshank, would help to increase efficiency in the accident and emergency department and decrease wait times?
Yes, and also too, if the specialties are on board with us, they can take those direct referrals, see the patients, and then admit to the ward. So we don't have to go through the A&E doctor. If they have gone to the urgent care facilities, they've gotten all their investigations, they have their diagnosis, and then can speak directly to the specialties. Some specialties are willing to take direct referrals from the urgent care facilities.
I know we glanced on this one as far as those NCDs, chronic non-communicable diseases, are concerned. Diabetics, what are you seeing as far as they are concerned? I know the not taking the medication in a timely manner. What else are you seeing?
We see the diabetic emergencies, which are the elevated blood sugars that are so high the patient is presenting in an acidotic state, what we call diabetic ketoacidosis, or hypoglycemic hyperosmolar states, which is another type of diabetic emergency. The blood sugars are so high the person can come confused, right? And even septic because an infection has thrown them off from the usual management. Diabetes is a medical condition that it's not supposed to be played with, and that's why that and hypertension should be managed carefully by the primary care physician so we don't see the complications that we are now presently seeing coming through the door of the A&E.
How do we help these patients? How do we best help these patients? Not only at that state when they present, because you do your assessments and you see how you can stabilize and bring them back to a sense of normalcy, but to be more proactive. What do they need to do? What is your advice to them?
They need to follow the guidance of their primary care physician, be it your private doctor or your polyclinic doctor. As we mentioned before, taking your medications, and don't let it run out. Don't wait until the last tablet in the bottle to now get the prescription repeated. When you see you're coming down to the week before, start getting your prescription filled. I know the drug service is very strict about the certain times that you have to repeat your prescription. Be on point with those dates and times. Following your diet plan. You cannot be eating certain things if you're a renal patient, or you are a diabetic patient or a hypertensive patient. Your physician and your dietitian would advise you on your diet chart, your diet plan. So you must follow your diet very strictly. You must follow your treatment plan. For example, some heart failure patients, they have their certain amount of fluid that they can use a day. They have fluid restrictions. So you cannot drink 2 liters of fluid in a day if you have heart failure. Your physician would advise you how much fluid you're allowed to use in a day.
When you say fluid,
whatever fluid you take, be it coffee, tea, juice, water, that's considered fluids.
Right. So 2 liters of water is not okay?
Not if you have heart failure.
Oh.
You have to be careful because you're on medication to diurese, i.e. to pass urine to get rid of that excess fluid.
Okay.
So you do have a fluid restriction plan, and your doctor would tell you how much fluid. You might be on 1 liter per day, 1.5 liter per day. You must follow that. But it's very problematic because the medications that you use to pass the water, it makes you thirsty. So your first inclination is to drink.
Yeah.
So you do have to have a very strong willpower to follow your treatment plan.
And when I think and when I hear this, because I'm so connected to reminding myself personally to drink water, as you said, suggested between 1.5 or 2.5 liters of water a day, and that messaging has been going out generally. Continue to be hydrated, keep hydrated. So when someone on medication hears that, then also hears on the other end, you have to limit your water intake because of whatever situation you have. It can be difficult in some cases.
So depending on your medical condition, you must follow the guidance of your primary care physician who is trained and your specialist.
Yeah.
And you must follow what they're telling you to avoid the complications of your particular illness. So another condition might need more fluids and another condition might need less. So you must follow your treatment plan for your medical condition.
Yes, I know it can be difficult for some of you out there, but please consult with your medical practitioner to find out how you can best take care of yourself relative to your health, relative to your situation, relative to your condition. You're listening to the Pulse Radio Show, a production of the Queen Elizabeth Hospital here on Q100.7 FM. We'll take a quick break and be right back to wrap up the show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You can call 624-7542 as you just heard. 624-7542 for MedSafe Medical Supplies Limited to find out what medical supplies they may have that you need. They have a wide range, believe what I'm telling you. I'm Shane Seeley, Communication Specialist at the Queen Elizabeth Hospital with Dr. Anne-Marie Cruickshank, Head of the Accident and Emergency Department, as we spend our final 7.5 minutes here with you on the Pulse Radio Show. Now, as you come to the Accident and Emergency Department, hopefully that is not the situation, but as anyone comes to the department over the next few weeks, you may see an increased foot presence on the ground in terms of a number of medical support staff that we will be having with us very soon, Dr. Cruickshank. A number of posts being granted to the Queen Elizabeth Hospital in A&E. What are we seeing there?
Right, so from last year, we had applied for an increase in the number of posts for certain staff groupings, and we have been granted that. So this year, we are moving forward with an increase in these posts. And I want to start off with the flow officers. We've been granted more posts for flow officers. And the flow officers are those medical officers who help us guide the patient through the flow of the A&E, i.e. input, throughput, and output. And they direct the patient as they go through the various stages, i.e. assisting with getting their bloods and their CAT scan reports and their medications, and then when the specialty comes down, guiding the specialties to the patients, and then from the specialties getting them up to the ward. So the flow officers are the glue that sticks the medical and nursing staff together with the patients and making sure that their progression through the A&E is smooth.
Right. Okay. So
The
you
next,
got flow officers.
yes, we have increased the number of flow officers. Departmental aides, we are having more posts allocated to us for departmental aides. The departmental aides are those persons that stock all the different areas with the supplies that the doctors and the nurses need, syringes, gauze, needles. They do that. They clean the ventilators, right? They go to CSSD and get clean equipment for the doctors and nurses to use. Their job is non-ending. They go from morning to night. It's just wonderful to know we have departmental aides that give us all the equipment and supplies that we need.
Nice.
Right? The next category is housekeepers. You would have noticed, Shana, when you come to the A&E, it is more or less spotless. And that is from the environmental office, the environmental department, doing a wonderful job in the A&E, and we have been granted more housekeepers to add to the great job that they're already doing. So these staff groupings, they clean the A&E, they make sure everything is spotless, and whatever body fluids or whatever goes on the floor, you just have to call them, and in 2 they have that mopped up, and we're back to normal. So the fact that we're getting more housekeepers will definitely ensure that the A&E is in a pristine and clean position.
I'm going to put you on the spot now. What about doctors?
Yes, we do have doctors, because remember the A&E has now an expansion. So we are now 18,000 square feet of A&E. So
Instead of 9,000.
Instead of 9,000. So we have been granted more doctors. So we have something called the expansion project, where HR has sent us additional doctors to manage the expansion.
Okay.
And we have the Ghanaian nurses that joined us recently.
Yes, indeed.
So we're not doing too bad in terms of medical and nursing. And finally, the orderlies. We have increased number of orderlies posts granted to us.
All right. So things happening in a great direction. The A&E department moving in a positive direction, and all of it is in essence to help improve efficiency there. Because I think that is one of the points of concern for many who have come through your doors. The level of efficiency and timeliness, and while you do your best to categorize patients and help them to understand, in some cases you may have to wait a bit longer. That will not be the general modus operandi going forward. You want everybody to get through as quickly as possible, but remember, you're dealing with medical emergencies, and sometimes these things can't be handled in a quick time. You may be a bit nervous, you may want to get back home to your comfortable setting, but we can't allow you to go unless you are properly assessed, properly treated, and your condition is properly managed.
And it takes time, sometime, depending on what your medical condition is and how ill you are. I want to say that, as you rightly said, Shane, we don't always get it right, but we do try our best. And when we don't get it right, please allow us to know so we can improve the service.
Yeah, and that's what we have been asking you to do right here on the Pulse Radio Show. Share with us your experience. Share with us what you would have gone through when you came through the doors at the QEH, whether it be the accident and emergency department, whether it be medical records, whether it be one of our outpatient clinics. Let us know your situation so that we can assess it, investigate it, and improve the service for others in your similar situation. It's all about making those improvements and enhancements at our hospital. We'll take one final call very quickly, and then we'll go to wrap up today's show. Good morning, caller. Welcome to the Pulse Radio Show.
Jane?
Hi, good morning.
Yeah, me again. So one question why I stressing on relatives coming to assist with loved ones.
Mm-hmm.
No, Shane,
Mm-hmm.
I'm still hurting over the years to see my family and my friends, especially when they give us the diagnosis, especially when they at stage 4 cancer.
Mm-hmm.
And I know how it is. I hurt every day. Even for Valentine, the whole day was reflection on my loved ones and my friends that are gone.
Mm-hmm.
And for me, the nurse cannot do everything. I had surgery on several occasions. I had to ask, I had a call on the nurse or those who alongside my bed that could move to assist me with something. And if you can go in your family or your friends in the last days of life, and you can go and make them comfortable, why not?
I agree.
I've been there. I lost my family and my friends.
Yeah.
And I've been there. And I feel that you should be able to go in to help make your family comfortable, especially when they have seriously illness.
Yeah, don't be daunted. Don't be daunted by those who may have a different opinion from what you share. But I will repeat a quote that is said very frequently by, or has been said very frequently by our Prime Minister: many hands make light work. So it's not only about helping our teams deliver quality care, but it's also about just having that will and that impetus to want to help your family member. That's your loved one. So it should be really par for the course that you want to have that sense of volunteerism to help, especially if it's your loved one or if it is a stranger. Just lend a helping hand. I think that is the direction our community generally needs to go. So thank you for sharing that with us again. Final comments to wrap up today's show, Dr. Cruickshank?
Yes, I want to encourage the public to please stay well. Please utilize your primary care facilities. If, however, something does happen and life does happen and you have to come to the A&E, we will do our best to treat you depending on your medical condition. And if it's not that serious, we will refer you to our sister facility, which is the 24-hour clinic at Sir Winston Scott Polyclinic, and bear with us if the wait may be a little long. We are inside actively trying to manage patients, and we'll get to you as soon as we can. And we do have patient relation reps who can listen to you and try to help you until you can be seen by the medical and nursing staff.
Thank you so much, Dr. Cruickshank, for coming back again here on the Pulse Radio Show. Dr. Cruickshank will be appearing on this program quite a bit this season, because as those changes and enhancements come into play there, we want to share them with you. Thank you for joining us on another edition of the Pulse Radio Show. I'm Shane Seeley. I'll see you next week, Monday at 11 a.m.
The QEH Pulse Radio Show is brought to you right here on Q100.7 FM with the kind compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.